Hello, and welcome back to the Who Are You podcast. I'm one of your hosts, Connor Overbay, and then you see Shannon Overbay on the side over there.
Hello.
Welcome to episode 171 of the Who Are You podcast. It's crazy to hear that number keep getting larger and larger. Make sure you guys give us a follow on the social media. This is your first time checking us out. It's going to be at Who Are You Pod from everything from Instagram, TikTok, Twitter, Facebook, all the normal spots. You guys know where to find us nowadays. Also, check us out on YouTube. The community is growing. We're very happy with everything going on. Make sure you guys keep liking, subscribing, commenting, all that good stuff on there. It's going to be Who Are You podcast if you guys want to leave us a subscribe on there. But today, I'm sitting down with a very, very special guest, a person you guys have probably seen on social media. You guys seen it on News for Jacks, really a mix of places. Today, we want to welcome Miss Christina Feliciano.
Yes.
I got it. All right.
You got it.
Welcome to the podcast.
Thank you for having me. I'm really honored. Thank you for inviting me on.
Of course. And obviously, just to kind of give a little bit of a background on you, from everything we've seen on social media, obviously you're big in the health and wellness field of everything, like testosterone replacement therapies. Obviously, I see pictures all the time of people, their before and afters. It looks like you guys are doing amazing work. So, like I said, thank you so much for sitting down with us.
Thank you.
And if there's anything you want to plug, promote here at the beginning, any social feeds, you're more than welcome to.
Okay, yeah. So I am the owner of AlphaClinic. I'm a board-certified nurse practitioner, and the AlphaClinic is a wellness clinic. It's close to the town center. It's between Beach Boulevard and the town center on St. John's Bluff, and I specialize in men's testosterone hormone replacement as well as body transformations for men and women, and then some aesthetic stuff like Botox fillers. But really, like, my heart is body transformations, just helping people lose weight or gain muscle, and I do that with peptides and hormone replacement.
That's amazing, and I like the peptide things. That's a big topic of conversation nowadays. Like for me, for example, I'm a fan of like Joe Rogan, the king of peptides and TRT and everything. And, you know, I hear him talk about it, and obviously someone who has a good amount of money, right? A richer gentleman. Is testosterone replacement therapy an expensive thing? Or is this something that maybe insurance covers? Anything like that?
The thing is I tell people is for sure insurance can cover it. So if you're a male over 30, your testosterone is going to go down. Now, most men, testosterone, when they're in their teens, are like high hundreds to low thousands, right? So once you're 30, it's going to go down under 500. That's considered a normal testosterone, right? But you're going to have effects of it being lower libido, lower energy, not as good sleep. You're not going to be able to lift as much. So there's certain things with it being lower. Now, if you go to a physician and you're under or over 30 and your testosterone is under 200, so it's like in the 100 something or lower, insurance will cover for testosterone replacement therapy.
Interesting, okay.
That being said, insurance is going to cover to get you to what's considered normal. Now, normal is above 200, right?
Gotcha.
So they're going to do a low dose to see if you are, to get you normal. What we do at the Alpha Clinic is we get you to what we call super therapeutic levels. We are giving you high levels of testosterone that are going to get you to levels that you had at your teens and 20s, sometimes even higher. So we'll sometimes get you to thousands to mid 1000s. That being said, we do our medical director is Dr. John Marshall. He works at University of Florida. He's also a professor at Johns Hopkins. Like he's a really good physician. He would do everything safely. When you get someone on testosterone, and we're getting to someone that high levels, a lot of physicians don't want to do it because there's people will say there's cardiovascular risks. So cardiovascular risk, like you'll hear, you don't want to be on testosterone. You are at stroke or heart attack risk. That's not true. It's first off, they have taken it off as being a cardiovascular risk, but when physicians used to say, or they maybe currently say it's cardiovascular risk, what happens is when you give yourself testosterone, it increases your red blood cell count.
Okay.
So when you increase your red blood cell count, in and of itself, that's positive. Extra red blood cells, extra oxygen to the brain, to the muscles. It's the opposite of anemia. Here's the thing, is if you keep on in your veins producing extra red blood cells, where's it going to go? There's going to be too much in the veins, and now you're at a coagulation risk. Or it could stick together, or you could be at a pressure risk because there's so many red blood cells.
Gotcha.
So the antidote to that is to donate blood. We will write a prescription to One Blood, and on One Blood, the prescription form, the number one reason it says why is because you're on TRT, testosterone replacement therapy.
Oh, okay.
So we check your blood levels monthly at the Alpha Clinic. Now, most physicians or primary, even if they want to be nice or give it with insurance, they can't do those high levels because insurance isn't going to cover the monthly labs. So that's part of it. Also with TRT, you have to keep an eye on the PSA, which is the prostate-specific antigen. Knock on wood, I've never seen it elevate in practice, but it is something you do have to keep an eye on. We keep an eye on that. And then also estrogen levels. So with the higher testosterone, naturally men have high testosterone, low estrogen, women have high estrogen, low testosterone. When you are giving someone by an exogenous source testosterone, sometimes in men the estrogen levels can go up, which is the opposite of why men want to be on testosterone. So then we prescribe a anastrozole, which is no extra charge at the AlphaClinic, which is an estrogen blocker.
Okay.
So this is like our specialty. So we are really good. So we feel really comfortable. We do high doses, but we do the regular labs, and it absolutely helps men and it changes men's lives. So the short answer is you can get insurance to cover it. However, probably the treatment that you're going to get and what we're doing, which is really higher doses, you're not going to get insurance to cover.
Gotcha. And the reason why I asked about that as well is my father, funny enough, is on testosterone replacement therapy, and he's been on it for years. He's had low T for probably since I was teenager, maybe even a little bit younger. Like I remember him doing the gel on his arms. I think he still does that. I don't know if he does injections or not on that side of things, but I remember that. And like for a while there, as you were saying, like the dose level, right? The doctors weren't getting it right for a little while, so there were some side effects of him being a little moody or just being super energetic, and you're like who are you?
No, for sure. And the thing is, and there's some primary that might prescribe the way I do, most don't. And then you also do have to be careful with it going too high, because it can affect. I tell men, if you're not prone to be hyper aggressive or road rage, it's not going to make that happen. But if you already have that predisposition, it can make you more aggressive. So we have to keep that in check. But usually like low thousands is a level where most men over 30 feel good, and they feel like more aggressive, a little bit more libido. And also the other really cool thing is we're doing a lot of body transformation is that testosterone, when you have it, it makes you physically stronger. So there's two things that like we offer if you're trying to get like extra muscles. That I had someone recently say, I want to be like, or a lot of men are like, I want to be natty, which is natural, which is great. You can be natural. It's just that you're not going to be able to get the muscle gains naturally, like no matter what you do. With testosterone at those high levels, you can lift heavier so you can put on more muscle.
Exactly.
So it's just, it's not quote unquote natural, but if you want those extra gains, there's some I don't know if artificial is the right word, but some things you have to do. And then we also offer Samorelin for muscle building too, which is a peptide.
Gotcha. And that's basically, obviously me guessing here, that's more of like helping with the repair of your muscles,
no,
right?
Actually it's not for that particular one. There is, you are correct, there are peptides that do that, but not the Samorelin. The Samorelin actually works in the pituitary gland, and it stimulates your pituitary gland. So the pituitary gland is a gland in the brain that does different hormones, and one of them is that it secretes HGH, which is human growth hormone. So when people are on anabolic steroids that are illegal, or that's not true, there's one that's legal, that's written, that there is an anabolic steroid that is prescription that has been FDA approved for children with dwarfism, but
really?
Yeah, there is. So there is one. So if it's approved for children, if they're in so there is one anabolic steroid, and you could prescribe that off label, but it's like thousands and thousands of dollars, so it doesn't get prescribed off label, and people go to the streets to get it instead. But that aside, that basically anabolic steroids is like human growth hormone. This is not HGH. This is legal. What it is, it's stimulating your pituitary gland to create more of the human growth hormone. So it's a similar effect, and it's been approved for both male and females. Now there are some females on testosterone. I'm not. I personally, it's kind of. So many, and the medical community is okay with females having testosterone. I haven't gone on board there, so I prescribe no female testosterone. I don't take it. Maybe in the future I'll change my views on it, because I've had opinions on things that throughout the years I change. But right now, personally, I don't prescribe it. I don't take it, but I do take Samorelin, and the Samorelin helps secrete the human growth hormone. So again, you have to work out, but if you work out, you'll build extra muscle with that.
Gotcha.
So between the Samorelin and then for the men, the testosterone and Samorelin, you'll gain extra muscle that you can't gain, without it. And with women with the Samorelin, you'll gain the extra muscle.
Interesting.
Now, what you're talking about with the recovery, that is BPC 157. That can really help with recovery. The FDA has gotten really strict about that. So even compound pharmacies, we can't get an injectable. I can't get it in oral tablets, but I can't get that in injectables.
Gotcha. Yeah, because I was hearing all about that.
It works wonders.
I've heard, like I think they nixed that off the athletes, right? Like, so NFL players, all them. I don't think they're allowed to take that anymore, right?
No. So this is my view on a lot of this is, money makes the world go round, and right now in the United States, and it's not. This is my perception, and it's not really good or bad, but this is how the medical system in the United States works, is that our system is based on insurance, and insurance covers medical ailments. The way that you get insurance to cover medical ailments is that you have to have a disease that basically you have to have a diagnosis that's covered by an ICD-9 or ICD-10 code. So you have to have a physician see you, code ICD-9, ICD-10, and then depending on whatever diagnosis code that is, which is always an ailment. There's not like an ICD-9 or 10 like healthy. There's always something. Then you can get a medication to treat that ailment.
Gotcha.
So it's all about it's like sickness. So there is wellness in that they'll say like do preventative like breast cancer screening, but really like medicinally it's not. And then big pharmaceutical companies, what they do is they're creating drugs and they get patents on it, and then the patents basically like they're expensive, and then physicians are pushed to basically prescribe different things, from pharmaceutical companies. So it basically is like right now in the United States is like you have to be sick and then you have to have medications, and then the medications that are pushed are medications that the big pharma company makes a lot of money off of. And there's a lot of people making money off people being sick and staying sick, and there's not a lot of money in being healthy, because if you're healthy and you're not having ICD-9 or ICD-10 codes and you don't need big pharma, then where's the money?
Right, it's all facilitated so that they keep making money.
Yeah, and I haven't had health insurance for years for this reason. I mean, there's a time. I mean, right now with the system, so if I get a car accident, I'll have to pay out of pocket. So it's not. I'm not saying that like there isn't benefits to following the system right now. So there for sure is. I'm not advocating to do what I'm doing, but
I don't have health insurance either.
Yeah,
so I'm right there with you. Yeah.
But it's just like the system. So what I'm doing at Alpha, and I'm doing a very like minute but it's just I'm trying to get people what I believe is things that are like healthy, that are helping with wellness that for the most part wouldn't be covered by insurance, because either it's not covered by insurance, for example, like NAD+, which is an amino acid that can help with cellular repair, or you can only be prescribed like testosterone if you are basically low T, or the GLP-1s only if you're obese or diabetic. So I'm prescribing it off-label, and I am for profit. I am getting paid, but I also believe too, like I'm doing it. Well, like the model is the same, I guess, for all businesses, but I'm trying to do a little bit more like wellness promotion and trying to get people healthy and lose weight and get in shape. And then I always am trying my best to give free tips of like things that you can do absolutely free, which is practice gratitude, get outside, get in nature, if you have a problem, don't drink, don't do drugs, don't be isolated, laugh, sleep, drink water. There's all of these things that are completely free that I'm a huge advocate of trying to help people. Take care of yourself without monetary.
Yeah, it's all great things to do, you know, like especially like going outside, right? Like with my job, I was telling you, like working in the HVAC industry. At the end of the day, yes, I am tired, but I do feel good by being outside, right?
For sure. And the vitamin D.
Yeah, being locked inside in like offices. Like I've worked office jobs in the past, and I felt like, more depression kind of side of things coming up. So I think it's great to get outside. And ask on the other side of things with testosterone, is there something that like an everyday person can do to like say whether it's working out or maybe eating better and all that to boost testosterone?
Yeah, there definitely are. I mean, you can like sleeping regularly, working out. There's definitely some foods for testosterone. There's 100% things you can do to boost your testosterone, but it's gonna there's supplements you can get online that can, but I've never seen it boost more than a couple 100 points.
Gotcha.
So what we use is testosterone incipiate in sesame seed oil. It's bioidentical, similar if you had diabetes and you had insulins. You're not going to get to the levels that I'm going to get you, but there are things 100% that you can do naturally to increase your testosterone, but not quite to those high levels. Just like if you're diabetic or insulin resistant, there's things you can do to try to make yourselves more receptive to insulin, but it's not going to do the same as actually giving yourself insulin.
Gotcha. Yeah. Okay. And here, give me 1 second. I'm just going to adjust your mic real quick. You're totally fine. You're comfortable where you're at.
Red Bull.
Go right ahead.
Go-go juice.
Trust me. Caffeine and unfortunately nicotine for me are my go-go's.
Oh no, I love nicotine.
Yep, I do Zen. I'm a Zen person.
I'm not taking it now, but I smoked for years.
Oh, I did too. I ended up having to go get a respiratory pulmonary function test, and that's when I was like, I gotta quit the smoking part. But no, like the whole thing with like testosterone is interesting, right? And I feel like some guys feel like weird about saying, hey, maybe I have low T, or maybe I'm less of a man, or something like that.
There's a big like stigma where people think that it equals ED, which is erectile dysfunction.
Gotcha.
And it's not ED. So they're like two completely separate things. Not completely. So erectile dysfunction is erectile dysfunction, but that's a vascular issue.
Gotcha.
It's either a psychological issue or a vascular issue, but the testosterone is just the male hormone. So it's not ED. So all these men are like, I don't have low T. And it's like, okay, well, like that's not, like my T is just fine. And that's not what it is. Now, the testosterone, the higher, you will have a higher libido. So with the higher libido, it does kind of activate, like you might not have the ED issue because you have such a high libido, so you're hornier. But it's not like if you have true ED on testosterone, it won't necessarily cure it.
Gotcha.
Or if you, if you... Like, it's just different. It's just a hormone. And because of that, though, there's a lot of stigma because men think that it's like a sexual thing, and it's not. It's just the male hormone. And really, the men, for the most part, that come in are like over 40s. They're just kind of like feeling like more like lethargic. And they're just kind of like, they get their kind of like energy, a little bit like aggression back, and they just feel better. That's the most of my clients are. I have over 30, but a lot are like 40s, 50s, and they're just kind of, the testosterone just gets them feeling more youthful again, and they're more motivated to get to the gym, or if they're married, they get maybe more higher libido and hype, a little bit more sexual because they've had a lower libido. So all of that's positive. But if someone comes in really for like ED, there's other medications like a Cialis or Viagra that would help with the vascularity that I would prescribe.
Oh, gotcha.
And that's not my specialty. It's I do testosterone. We do testosterone, Dr. John Marshall, and then secondary people have those issues that we're not like. That's not what I primarily do at all.
You're there for more the healthy side of
exactly.
things. Yeah,
So, but if someone has a testosterone has that as a secondary issue, we can address, but that's not our like primary.
Gotcha.
Yeah.
And so how did you get involved in all this, right? What made you want to kind of practice and focus this?
Yeah, I didn't. So I wasn't like a little girl. Like, it's funny. So my dad had first moved to Florida a couple of years ago. It was Halloween the first time we came to the clinic.
Oh, wow.
And I was in like a cat suit that had like a skeleton, he came in and I'm like, aren't you proud of me? Like, wearing a cat suit on Halloween, running a men's testosterone clinic. He's like, I couldn't be prouder. I'm like, thanks, Dad. So he's a wild man too. But no, so I had been, for the people that don't know my background, I'm a board certified nurse practitioner. I had worked years ago, like 14 years ago, for my first year at Ideal Image.
Oh, okay.
Doing laser hair removal. I didn't want to work there, and I loved it. I'm not knocking it, but I wanted to be in the hospital. I didn't have the hospital experience. I had years as an RN, but not in the hospital. So Milton, my husband, who's passed, he's on hearing on the radio, like, they were advertising like the entry-level nurse practitioners. I'm like, I don't want to do laser hair removal. But he kept on being like, well, you're not getting a job, so maybe you should, like, take it. So I got a job at Ideal Image at the Town Center. I worked there for a year it's Pilar, who owns Hello Smooth. So I don't...
Oh, okay. I've heard of that,
So Pilar, so it's just kind of cool because we're both, like, I don't think there's that many... I don't even know if there's anyone else besides Pilar and I that are NPs that own our own practices in town, but we both were, like... OG Ideal Image.
That's cool.
A long time ago, yeah. So we were both laser hair removal technicians, nurse practitioners there and for a year. And then after that, I went and I worked for IPC Hospitalist Company, which was an internal medicine hospitalist company. And I had privileges at Baptist, all the Baptists, Orange Park, Memorial, a lot of the nursing homes. Did that for years. Then I worked with Dr. Ashi, with Ashi Heart and Vascular for some time. I'm still in really good terms with him. He was on my podcast recently.
I think I saw that one, yeah.
And then I went over to UF and I worked neurosurgery, which everyone, like, I got the job and, like, everyone in my family, like, no one could have been prouder. Like, I felt like I was so, like, I'm working neurosurgery, which is, like, the absolute worst job for me because I'm a people person.
Yeah.
So why would, like, brain surgery or people that are, like, paralyzed or can't speak or, like, that's not, like, none of my gifts were used.
I understand.
So I was there for, like, a month and was like, this is not for me. I transitioned to ENT. There was a little overlay. Did ENT for a while at UF, and then I left there. I was still at UF, and I kind of like on paper, I kept on getting demoted positions because I was trying to do, not really, work life. And then I worked at UF Health Sutel. I'm off Moncrief. I lived by Dinsmore, which is by Callahan at the time. I actually loved it. It was like inner city, but we did internal medicine family. Did that for a while, and then we moved up to North Dakota. Worked for the government Indian Health Service with Spirit Lake Tribe. He passed, and then when I came back down. Long story short, I was incarcerated for 18 months. When I got out, didn't have a job for a while, worked at Amazon for like a year, was going through custody stuff, and I always maintain my licenses with my incarcerations. I have no convictions, and I was trying to get a nurse practitioner job, but I wanted something chilled, and I didn't really want hospital, and by chance, by like the grace of God, and I believe everything happens for a reason, Semper Laser was opening up a laser hair removal on Beach Boulevard. and they're a Brazilian company out of Miami, and they wanted someone that had laser hair removal experience and someone that could manage open up a location.
Gotcha.
And I had that from Ideal Image, so thank Jesus, and for Milton to so I spoke to the owners. They had me go down to Miami for a month training. I came back into Jacksonville. I opened up the Semper location on Beach Boulevard. Started working there as a laser hair nurse practitioner technician, and this is back in 2021. Was there, and then I had a client there that was like, "Hey, I know this guy, and he is looking to open up this more. We've opened up this med spa, executive med spa, and they're looking for a nurse practitioner." So I went over when I was at Semper, met at my current business partner. I came over initially part-time, and when I met him, he told me that he had this idea about opening up a men's testosterone clinic. We should do that too. So I heard that, it kind of sat, but I didn't think too much.
Yeah.
Came over at executive. It was an executive med spa twice a week, just as an employee. Stayed full-time at Semper, and then we started speaking more, and then we decided we're going to open up a testosterone clinic. So it ended up being that we had executive, and then we had Alpha Clinic, and they were two different businesses under the same umbrella.
Yeah.
And then throughout, I'm trying to make a long story kind of concise. I ended up coming over full time. And then eventually I became part owner.
Gotcha.
And then we ended up kind of stopping executive and morphing it together to Alpha Clinic. So instead of it being executive health and med spa and Alpha Clinic, or Alpha Testosterone Clinic, we became one, and it became Alpha Clinic.
Nice.
And we merged everything together. And then when the whole testosterone thing is because he had given me that idea on my own, or with his, help, I did all these continuing education, so much for men's health to learn about it all. And
that's really cool.
I got all these different men's health certifications, and then that's kind of how it came about.
That's amazing.
Yeah.
It sounds like you were very motivated. I love to hear that.
Yeah.
No, that's amazing.
So it's just kind of happened. Now, I think about it, it's weird how it just because even how I came over part-time to full, it just kind of now I'm here, and I'm sometimes I don't know how I quite got here, but here I am.
That's kind of the same for me and Shannon. Yeah. Our saying is just, we're going to make it work. We'll figure it out.
Exactly.
It just happens,
So.
But that's amazing. Good for you. And
but we are going back now to do more tests. So it's almost like we were doing both, but we're now going back to refocusing more on men's health as a niche. And I think going forward, long term, that's going to be our bread and butter.
Okay.
Just because with the weight loss, Big Pharma is pushing back a lot about compound pharmacies doing weight loss, and there's just so many different things. And just the men, they're great clients. They stay on long term. There's a need for it here in Jacksonville, so I think that we are slowly morphing. I mean, we've been doing both, but we're really going to specialize in men again.
That's good.
Yeah.
And the thing I was going to ask you as well, right? So in today's world, the big thing, Ozempic, right?
Yes.
That's a huge thing, and I've been hearing about negative side effects. Obviously, I am not a medical professional in any way, shape, or form. Do you have any opinions or any idea on that?
That was so I've been a weight loss clinic. So up until recently, that was my primary thing that I was selling, was semaglutide, which is the generic for Ozempic. So I have strong opinions about it, but I understand why there's backlash. And there is two different generic medications. These are both GLP-1 peptides. We talked about peptides earlier. Now, there's semaglutide, which is the generic medication that's found in Ozempic and Wegovy. And then there's tirzepatide, which is the generic medication that's found in Zepbound and Mounjaro.
Okay.
Now, both of these are you can get by Big Pharma. Now, their GLP-1 peptides work in 4 different ways to help you lose weight. The first one is it makes you not as hungry. Second, full faster. Third, and these are 2 things that you can't do on your own. You have to have a GLP-1 peptide. Third is it blocks the dopamine response when you're eating sugars and fats.
Oh.
So you don't even know how much. You guys are both trim, but for people that have binge eating disorder or obese, you don't even realize how much pleasure food's giving you until you get that dopamine receptor blocked. So usually, it's a good thing, people like it, but the reason people do bad behavior, so for example, I'm in recovery for drugs and alcohol, the reason that people do a binge eating disorder, even though they want to lose weight, is because it's giving them they're getting a temporary reward system. When it blocks that reward system, it makes it a lot easier to make healthy food choices. So when they're eating sugars and fats, they don't get that same reward, so they're going to eat less of it. And then also, you can use that time to make healthy food choices and different changes of behavior. The next thing it does is it helps your cells be more insulin receptive. Doesn't mean that you're diabetic, but more receptive. So I always kind of give this illustration that basically, this is your cell. So this is your cell, and inside the cell, there's sugar that has to get burned. On top of this, let's pretend this is a bloodstream, and you need the bloodstream to get inside this cell to burn sugar. Now, if you're insulin resistant, you may or may not be diabetic. You just have a little bit of a portal that's allowing the insulin from the bloodstream to go into the cell.
Okay.
A GLP-1 peptide opens up the portal. So all of your insulin is going to come in. So it's not creating insulin, but it's making your body more receptive to your own insulin.
Interesting.
So when that happens, you're going to burn sugar quicker. Basically, you're going to burn some more calories. You're going to burn sugar quicker. I don't like to emphasize that to people because I don't want people to eat a lot of sugar on it, but it's going to, burn it. So the GLP-1 peptides, I think, is an absolute excellent way for people to lose weight because it does two things that no matter how hard you're trying, you can't do. You can't burn the sugar quicker.
Yeah.
You can't block the dopamine response. That being said, I understand why there's backlash because if you take this shot and you make no behavioral changes, you're going to lose weight, you're going to lose muscle, you're going to gain it all back as soon as it ends
That was
because you have not made behavioral changes. And that's why, too, with the clinic, I did have success, but I would have people, I was guaranteeing weight loss. I was bringing them in weekly. And what you have to do on these medications is twofold. You've got to be lifting weights. You've got to be eating a ton of protein. And you've got to be eating low carbs or low sugars and doing behavioral changes because otherwise you're going to, gain it all back and you're going to lose muscle. I always recommend people to get the REM Pro scale. It's on Amazon. You can get it for like $25. Get on it once a week, at least naked. It not only measures your weight, but it measures your body fat. It measures your muscle mass.
Oh, wow.
Yeah, and it's reasonably priced. And I use it. So you're not just looking at the weight number, but you're looking at the other body compositions, and it says where you are, whether you're like fitness or average or, obese, but there's a lot more than that.
It's a wider range.
And there's all these different things that track. So that's really positive. So I understand why there's a backlash for the GLP-1s. I do think that it's an excellent tool. Also, people get I've had several people that have lost over 100 pounds with me.
Oh, wow.
So many people that have lost 30, 50, 40, and it was life-changing. I really made a point to really be an advocate and see people, and even now patients that are still on, like, are you exercising? And I think that if you make those behavioral changes, it's great. And I think that it's really life-changing. Like, I think I'm not a super, all medications are great. I think antibiotics 100% are life-saving. I think in the right, when it's used correctly, steroids for anti-inflammation for lungs can be life-saving. Obviously, chemotherapy. There's certain things. I think the GLP-1 peptides, when it comes to weight loss, kind of falls into that really special category that it can be really, really positive. But I do understand the backlash. The other thing with GLP-1 peptides is it can make you very, very sick. Diarrhea, constipation, vomiting. If the dose is too high or people are sensitive to it, especially the semaglutide. So people also get misdosed or they're really sensitive and they're really sick. And then if you get really sick, I'm very sensitive to it, so I can understand why someone gets sick. So also too, I understand the backlash if you are vomiting.
Yeah.
And some people are like, well, that's good. I lost weight, but I was sick the whole time. And then people would say, so I understand well, that would be a negative. That's not something I would be an advocate of. So I understand why there's backlash. However, I don't really know another. People say diet and exercise, but this is going to help you lose weight quicker. Yeah. And not even quicker. I think that I think there's some people that are resistant, especially the insulin resistance, and there's certain things that this is going to help you get over that threshold.
It has all those topics that you said that you can't get naturally.
Yeah.
So that's totally understandable.
Yeah. And as you said, it's a tool, right? So it's not the end all be all. It's not the magic drug or magic medication, whatever it is. It's meant to be used with diet, exercise, and everything.
Because right now, so there's a big backlash. So big pharma is suing. I, for example, use Strive Pharmacy for some of our medications, and Lilly, which is the big pharmaceutical company that owns Mounjaro and Zepbound, they've sued Strive. And it's just hard because with Mounjaro, and now they're saying you can do private pay, but it's the big pharma wants you to pay more money for them, and then you also have to have these ailments, and it's just hard because the GLP-1s, especially in small doses, really could be really good for everybody, but that's kind of another topic. But right now, I actually think that the GLP-1s, it's not an end-all, be-all, but I do strongly believe that it could be a long-term solution for people to be on long-term at low doses for people that are obese with diet and exercise. It's not right now with the legislation and everything. It's not a really feasible long-term option, or right now with everything kind of being fought. But I personally think that there's a ton of research that shows great long-term benefits to low-dose GLP-1s.
Okay, I like that.
And I think So you were saying you're moving back towards more testosterone replacement therapy stuff.
And maybe low-dose GLP-1s if I can. It just depends with the laws.
Yeah.
I'm going to be legal and follow the laws.
I understand, 100%.
Yeah.
But even just having the TRT, does that, I mean, you got to work out, exercise and things that also increases. Does that
so I always tell men that there's like 2 body types of teenage boys. There's fat and pimply and shredded. So I'm giving you a hormone. One of the, you can get bacne and fat, or you can get shredded. So I'm giving you a male hormone that's going to, if you have that now, if you have that extra energy and you go to the gym, and then you go to the gym and you lift weights, you're going to gain muscle, which is going to have a higher BMR. With the higher BMR, you're going to burn more calories. So so if you're working out, you will, not the same way a GLP-1 will, but you 100% will lose weight on testosterone if you're in the gym. And a lot of men do lose weight when on testosterone, but again, you've got to be in the gym. Whereas a GLP-1, you could not be in the gym and lose weight. Again, that's not what I'm advocating.
I understand.
Again, like you said, you're going to gain it all back once you stop it.
But the testosterone for sure can help you lose weight. And it just, but the reason you're losing weight on testosterone is that extra exercise and also the higher muscles. And that Run Pro scale I have, they show BMR too, so that's pretty interesting. So if you ever like look at a bodybuilder that's like super built, he could eat, or she could eat like icing and pizza, like it would just get burned right away.
Yeah.
They're not going to do that long term because they won't be able to keep, but in short term because they have so much muscle. So the higher muscle you have, the higher basal metabolic rate, which is how many calories you burn at rest.
Okay.
So if you have a lot of muscle, you burn more calories at rest, so that gives you some more wiggle room to eat. So if you're on TRT and you're working out a lot, you're going to have a higher BMR, so you're going to be able to eat a little bit more.
Gotcha. And you're like we were talking about bodybuilders, right? Those are well-oiled machines right there. Their body is literally burning things.
For sure.
And whatever they eat, they literally choose everything they're eating for muscle recovery, all that stuff.
No, 100%.
But no, that's interesting. And like I said, that was just the biggest topic for a while there, and I hadn't sat down with a medical professional to really ask about that. So I was interested because I've seen some family members, not going to throw shade on anybody. I'm going to leave everybody alone. But like, I've seen people who are a little bit heavier and now they're like gone, like very skinny. And I'm like, and I've like thought about it, like, should I say something? I'm like, it's not my place.
Well,
you know what I mean?
Too, especially, I don't know if it's females or not, but there was, I think it was Aubrey Hepburn, but she had said back in the day that as women age, they have 2 choices, either a good body or a beautiful face.
Oh no.
So that is part of it, is like as we age too, especially for females, if you get thin, you're gonna be a little, so part of it is Ozempic face, and they're probably losing weight now. And then part of it too is like, and especially too if you've gotten big and you've had fat, and then you lose it.
Yeah.
And that's the one thing. So people will come in and they'll say things, and I've had quite a few, but that I've had to have plastic surgery after losing weight
For like extra like hanging skin. It happens.
Only so much you can do. So let's say with the face. So unfortunately, if you're 300 or 400 pounds and you lose 200, you're gonna have to have surgery.
I remember
you don't have to, but for aesthetics, like
I remember seeing that with like I don't know if you remember the show Biggest Loser. You remember that? I remember that was the thing. These people would come in 600-800 pounds, right? And then they would be say maybe my size, right? Like I'm 210, 215 pounds. That's a lot of skin that was stretched out for so many years, and sooner or later your elasticity goes away, all that kind of stuff. No, it's definitely interesting. And to switch over to another topic of you, obviously you're a podcaster as well.
I just started. I'm trying.
So what kind of made you want to start that, get involved in podcasting? Obviously, everybody has their own reasons. Everybody's interested in different things.
So one is I like talking to people. So the reason, this is why I'm doing the podcast, a couple different reasons. Number one, I'd love to monetize it and make money talking to people, because I love talking to people. So if I could like do that and make money. So that's my number one reason. The second reason is, it's called OPA, which is other people's audiences. I don't really promote Alpha on the podcast, but what I'm hoping is that I have interviewed different people, and then when I'm promoting them, that maybe those people will see me and be like, oh, what does she do? And it kind of go to Alpha. So it's a way that I, without having to spend a lot of money, I mean, I'm doing it like in my home, like you are, I'm doing it all self-production, that I can kind of bring attention to myself. And then I'm not really talking about Alpha too much on the podcast, but if people are like, what does she do? They can maybe find it. So part of it is also for marketing for Alpha. The next is, I really do enjoy hearing people's stories. And one of my goals for most of the people, or anyone that I'm interviewing, is that I know when I was younger or when I'm down and out, there's a lot of times you see people and you're like, I can't be like that. Like, it just, how do you get from A to Z? And my goal when I'm interviewing people, I don't tell them this, but this is in my mind, is I try to ask questions so the audience can learn how they got from A to Z.
Yes.
Because I think what one man can do, another can do. So that's a lot of it, is just different, people. And I also think as a Christian that we're all equal to God, not equal to God, but that we're all like, no one's better than one another.
I understand.
And I think we can all learn from one another. So I have like a very expertise in a very finite, small area, and I want to learn from other people, and I think the audience, so it's just, a labor of love. And then also I like to laugh, and I think that not every single guest, but like, sometimes it's fun. And then, I don't have custody of my children. I'm hoping to, be reconnected with them when they turn 18. My oldest just turned 16, so that's 2 more years. And I know my kids, because I did have them for a while, and they are my blood, are pretty charismatic and fun. And I thought it was really cool. The idea behind Feliciano and Friends was also to have something that in like 2 years, when my oldest is 18, if he wants to come and, do a podcast, something we can kind of do together. So that's kind of why. So to monetize and to promote Alpha and to laugh and to learn from other people, to try to teach the audience about how people have overcome, to give examples of people that have overcome different hardships. And then I named it Feliciano and Friends, so my kids, if they want to take it over one day, if it lasts that long, then they can take it over.
We've said it multiple times on the podcast. We love hearing people's story because a listener could be going through something someone else went through and not sure how to get through it. Just hearing how they did it can help that person as well.
And the other thing too is like, when the more people I meet, I'd like to be able, right or wrong, I always tell people, like, I don't make the rules of the world, but I do try to follow them, right? Yeah. So I try to, when it comes to, not right, like, there's certain, like, just how the world works. Like, we're talking even with the insurance companies and things. Like, I don't always try to buck the system. There's a lot of things I disagree. I wish it wasn't that way, but I try to change what I can and accept what I can't. But also, too, for my kids is I'm trying to, make connections that maybe, like, will open up opportunities for them one day and whatever they want, and just get to know different people so that my kids could have more opportunities one day.
No, I look at that the same way. Like me and Shannon are really big on going out and like being the youngest people in the room. I like rubbing shoulders with people.
How old are y'all?
I'm 27.
Oh my goodness,
He's
you're
26.
baby.
I'm 26.
Yeah. Wow.
Yeah.
Still growing, but
just doing our thing. But no, like, podcasting has opened up a whole.
I was 16, I could have had y'all. At 16, I could have been your parent.
Yeah. I'm just tall. That's all everybody thinks. I'm like, you're what, like 30? I'm like,
that's super cool. Y'all have kids?
Nope.
Not yet.
Nope.
Okay. Hopefully in the next couple of years, but we're wanting to get in a house first and see where we're at.
Cool. We've been married for 2 years, but been together for going on 10.
Awesome. Very cool. I love that.
Yeah, we met at work. I was working at Five Guys, ended up taking over her store as a manager, and then 1 month into dating, she moved in, and here we are.
Yep.
Oh, very cool. Nice. I love that.
Yeah. No, it's been a great time, and I think the podcasting thing is, a lot of people get into it and they think, why don't I have 1 million views and all this kind of stuff. It just takes time. Me and Shannon have been doing this for 3 years, and it's a grind, but it has opened up many doors. The job I work at now, I got from podcasting, from making friends with people and doing all that stuff. It's just, as you said, it's a labor of love, right?
Yeah, that's where I'm like, I really enjoy doing it. Like right now, I'm not making anything, monetarily.
I understand.
But I really enjoy it, and it's something like I hope I can do long term, just because I really enjoy it. So hopefully Alpha can take off, so that even if the podcast never takes off, I can still be talking to people several times a week and hanging out and.
I totally understand.
Still having the bills get paid.
Yeah. 100%.
And same thing as, like you mentioned, have your kids on it or open doors for them. We hope eventually, whether we make money or not, it could either be a time capsule for our kids to go back and listen to what we're doing, or it's the Who Are You? If they're interested in as extroverted as he is, they could take it over as well. I never thought about that part of it.
No, that's that's what I'm like.
Yeah, I say for me, Shannon knows anytime we go networking events or anything like that, she'll be sitting next to me talking to someone, and then I just dart off. I'm like, I'm all throughout.
Well, I keep on wanting to I don't know why, but I keep on wanting to sell coconut water because I feel like that's on brand.
I love
coconut water place out there.
Fiend for it, and I absolutely hate the taste.
I'll advertise and sell your coconut water.
Hey, any coconut water brands, hit her up right now.
Yes.
I'm like, that's what I feel like my calling is. It's to be sponsored by some coconut water, and I will sell it because I love it.
I love it.
I can't get on board with it.
You can't.
See,
I love coconut water. It's so good.
Right?
I'm so weird because I say I don't like coconut.
The sponsorship.
I know.
You're killing the sponsorship, Shannon.
Hey, those episodes that we promote, it can be just you.
That would be me. But so outside of, obviously we talked about your profession and all this stuff. What's like your pastime? What are you interested in outside of, podcasting?
Not much.
No?
Ask my friends.
You like more of a homebody hanging out, or?
So I've been like this since I was like, so when I met my husband at 21, I was super driven. So even then I was like, he was driven. We always put kind of like our careers and family. So I've always been Jesus, my family, and making money. And then my friends. And my friends, I've been so blessed to have the most amazing friends that have stayed around. Not many of them, but more than most for like 20 years. But that's kind of always how I've been. So, I mean, for fun, I'm like Pilates, yoga, working out, going to the beach, maybe laying out with friends. But I'm like reading. I'm a homebody. I don't go out really.
I literally stay home. I do puzzles. I read. Maybe I'll go sit by the pool. But again, I have my books. I'm not talking to people. No. So I'm just really, I mean, so I do things for fun. I would say but I'm pretty go. And my relaxation is like, I beach walks, but I'm like a extroverted introvert. Like I need time.
Recharge, get through. Yeah.
So I'm not like, I mean, people are like, you're always everywhere. But if you actually really follow what I'm doing, a lot of people are visualizing me, but if you notice, I'm not around a lot of crowds. So I'm doing my podcast. It's in my condo. Yeah. I'm doing things at Alpha. That's my little clinic. I'm going on River City, which is a small. So although thank God I'm reaching a big audience, I'm not, if you look at it, like I get invited to like DECA and things like that. Really what. I'm not going.
Okay, I was going to say, I was like, that's a big one.
That's not my thing. I mean, it's not knocking it, but it's like
not your style.
You'd rather be home by yourself.
Yeah. Not to say I won't ever, like I said that and like watch me go. Because I'm trying to sell Alpha, but I don't know. But it's not really my scene. It's never really. I've always been kind of country, and like even when I drank, is kind of like more like holes in the wall and go on the boat, and I've always been more that than like big clubs. Has never been really my thing.
Yeah,
I know you had mentioned yoga. I saw that you were trying to get your
yoga certification. Yeah, so I'm doing hot mat Pilates certification at Core Motion Fitness in Jacksonville Beach, and then I'm doing yoga teacher certification training at Titanium Yoga that has a studio in PV and Fruit Cove. Nice. So I'm doing both of them right now. I should be Pilates hot mat certified trained by the end of August, and then I'll graduate. If I pass, I do everything. The yoga teacher certification that's approved by the Yoga Alliance November 2nd of this year.
Congrats. Cool. That's huge. Love to hear that.
And we had a Zoom required meeting yesterday, but I missed though.
Oh no! It happens. We've all been there.
Teacher, can I make it up?
I do. I have to like view it and do like a report.
Oh my gosh.
It was like they were really like F around then find out. Yeah, like I have to I was like, what can I do to make it up? They were like, yeah, you can.
Write
like
a
do that,
report.
or whatever. Yeah.
Don't miss another.
Yeah, for sure.
That literally sounds like college. I had to do that before. Exactly. Like you missed a class, you got to do this.
So funny. So in the yoga thing, we were supposed to be like writing down our feelings, and I was like, I hate school. And then they were like, do you want to share? And then I was like, I'm going to have to make something up if we all have to share, because I really thought this was private.
Yeah.
I understand.
But it's funny because I have like 3 different degrees, but I want to learn everything with Pilates. I want to learn, like I want to have the knowledge so I can teach, but I don't like school. I don't like sitting, like it's like, it was giving me like flashbacks of like, I dislike this.
Well, especially all the schooling you went through. I was like, I know that was not easy stuff.
Even at UF, so I was in the DMP program, the doctorate program. But in like small print, they were like, you can opt out in the master's level. I was like, cool.
Yeah, I'll do that.
Yeah, and people are always like, you should be a doctor. Would you want to go back to? No, I don't want to go back to school. No, and I mean, so the reason I'm going is because I want to learn Pilates. So I'll do it if it's like because I want to learn something to teach. But like in and of itself, like I don't want to go to school for the sake of it. It's like to get to the.
Gotcha.
That's how I am. No more school.
Yeah,
please.
And we're getting closer towards the end of the pod here, but I do have 2 final questions. And the next one, if it's something you don't feel comfortable talking about, feel free to let me know. So I was going to ask about sobriety.
No, I can feel comfortable talking.
Okay, just want to make sure. Yeah. So what does sobriety mean to you? Like, what was the thing that made you decide to get sober, if you don't mind talking about that?
So I mean, I come from a long lineage of addicts. my kids from both sides. And, you know, I've always partied and I had a lot of fun. I was prescribed a lot of different, like, narcotics, like, prescription-wise. And it just, when my husband died and then my kids I lost custody of my children in part because of the allegations of prescription drug abuse.
Gotcha.
It just doesn't really serve me. So I love to feel good and feel happy, right? 100%. I'm very hedonistic naturally. I love pleasure. So I love being a little drunk. I love being a little high and fun. But for me, it just doesn't serve me. I make bad choices.
Gotcha.
I have self-destructive patterns of behavior. And, you know, when I was incarcerated and I look back at my life, like I was for 18 months and I had a lot of time to self-reflect. You know, had I been sober-minded, I could have made better decisions. I'm a Christian, and there's a verse in Scripture that says, depending on the translation, be sober, be vigilant, because your adversary, the devil, goes around like a roaring lion looking like for someone to devour. And when I look back on my life and things before my husband's death and my children, there was a lot of like smoke and red flags that I didn't see because I was not of sober mind. So because I was not of sober mind, for me, it's something I view that I'm going to struggle with for the rest of my life, and that it's a living sacrifice I have to make for the rest of my life, because I naturally even right now, I would have rather taken a couple shots or taken a couple pills to feel more relaxed, but it's going to be self-destructive.
Understand.
So for me, sobriety is just I'm a better person. It's harder for me. I feel like I actually suffer more because I still have moments of like depression or anxiety or stress, or even when I came in here, I was like, I'm feeling anxious because I don't know you guys.
Of course.
But for my employees, for my patients, for my parents, for my children, for for all everybody else, I'm a much better person, and I'm a really loving, kind person when I'm sober, and I'm the best version of me. So even though for me, being in my skin, it's sometimes harder, for everyone that I love, it's so much better. So that's why I pray to Jesus that I can stay the straight and narrow and stay sober.
Well, congratulations either way. Like, you know, it's can I make it to the next day, right? Yeah. And that's all you plan for on that side.
Yeah. And because I feel like it's life or death for me. Like, I think that if I were to really relapse, I'll end up dying. Like, I don't think I have like another, like, I don't think that my story is going to end different than it does, you know, like for other people. So I think that for me, like, I think that if I really relapse, that I would die, and I don't want to die.
I understand. And I had experience of working in Narcotics Anonymous centers and AA centers whenever I was going through high school, getting hours and stuff. And that's something that I kind of paid attention to a little bit more as a young man. You know, everybody thinks about partying and doing all that stuff. And then I would sit in the meetings. Like, I was the guy who would go serve you coffee, all that kind of stuff. If you need a pack of cigarettes, go get you a pack of cigarettes. But I would go sit in the meetings and just listen, because I was very interested in hearing people's stories, because like you were saying, from A to Z, right? Yeah. How do you get to this point? And everybody had a different reason, right? Everybody had a different situation that they may have been in, that like I could see how it led to that situation. But congratulations on being sober. That's a huge thing.
God. It's not me.
Yeah, there's a lot of people out like obviously still struggling. It's a sickness, you know?
No, for sure. And I think it's something I'll struggle with forever.
Of course.
And I'm not really part of AA. I've gone before, but there's a thing in AA where they say it's cunning, baffling, powerful. And I have taken that away, and that like it's something that you have to really be careful with, because there's like something in your brain, even though I know like my life is so much better, like I have everything because of sobriety, that's like, you know what, like I was talking to a friend where it's like, maybe you didn't lose everything because of the drugs and alcohol. I'm like, pretty sure it was.
It's the little devil on your shoulder that's always whispering in your ear.
What it was. Like, it was just those assholes, you know, like whatever. It wasn't, you know, the kind of is like, maybe you should. And it was wild, because when I was really down and out, it was easy to be like, when I got homeless and like lost everything, like I'll never do it again. But as I start to get more back on top, I'm like, well, I have more temptation now when I have things where I'm like, well, maybe it wasn't that bad, because which I'm like, gotta stay.
I understand.
Straight and narrow.
I totally understand. Well, I got one more final question for you. Shan, did you have any questions before I kept on going?
I don't think so. I think that's been a great conversation so
no,
far.
it really has. And like I said, thank you for taking the time out of your schedule to come sit with us.
Thank you for inviting me. I appreciate y'all.
Of course. And you always have an open invitation if you ever want to come sit back down or, anything.
Now that you know us a little better.
Yeah, no, I'll ask you guys all the questions.
We'd be more than happy to.
I'd love that.
Yeah, feel free. Like I said, we're big on about cross-pollination, like you were saying about promoting and everything.
For sure.
Yeah, like with this episode coming out in 2 weeks, you'll get clips, all that kind of stuff. Perfect. So we're big on that.
Yeah, thank you.
But so my final question is a little bit of a deeper question on people. So anytime it's someone's first time on the podcast, I always ask them, do you feel successful? And if you do or do not, in what ways?
So, no, I mean, I don't feel successful in the sense of, like, for me, there's nothing more important than being like a wife and a mother. And I'm not a wife right now. My husband died, and I'm not an active mother because I don't have custody of my children. So as a woman, I don't feel like I'm really successful. From the world's point of view, I'm probably successful because I have a career and I have monetary gain. So from that like worldview, I'm successful. But from my personal and spiritual worldview, I'm not successful because I'm not a wife and I'm not an active mother. But I do believe that my intention right now is trying to build something for my children and for my future grandchildren. And I'm trying to build an empire so we can have financial freedom, that we can have peace, that we can serve God. So I believe that I'm working in purpose right now, and I feel good about that, and I feel successful in that. But I don't necessarily feel like I don't really feel like I'm successful right now by how I measure success, but I feel like I'm on the right path. And I do think, I guess I'm successful by the world's success. If you view a little bit of notoriety and a little bit of money as success, then I guess I have that.
I understand, and that's a very real way to look at it. I think that's great, and there's a reason why I asked that question today, and it's because everybody answers it differently. And you'd find it funny. Most people think they're not successful. It's very common. Like I've started to tally it a little bit more, and there's always something that we're chasing, right? Yeah. Like for me on my side of things, Shannon knows I have a major issue of once I do something or I achieve a goal, right? I don't care about it. I want to see what's next. That's a huge problem for me, and like taking a second to enjoy the win. No matter how small it is, right? Life's hard, obviously. You've talked about your life. We have our backgrounds and our things, and it's really just, as we said, make it to the next day, right? And one day at a time, keep doing your thing, and you're on your right track. You're doing the best you can right now, right?
Yes, I'm trying my best for sure.
Exactly. But like I said, we wish you nothing but the best.
Thank you, likewise.
Yeah, we greatly appreciate it. It was awesome to meet you.
Awesome. You guys are going to do big things.
Hey, we're hoping.
Yeah, and Jacksonville with you for hopefully years to come.
Yeah, definitely let us know if you ever need a guest. Me and Shannon will be more than happy to come on and talk.
We'll make that happen for sure.
Awesome.
Sounds good.
Thank you.
Thank you so much for coming.
Thank you for having me.
But before we get out of here, if there's any way, say someone wants to get in touch about the Alpha Clinic and all that stuff, what would be the best way to reach out to you?
You can go on alphacliniconline.com. If you're a man, you can also go to alphamalejax.com. And then if you're interested on listening to the podcast, I'm on YouTube and Spotify, Feliciano and Friends, or you can also go to felicianoandfriends.com, and there's links to YouTube and Spotify on there. And also, if you want to be a guest, there's a place where you can apply on there as well.
Hey,
awesome.
Yeah. You hear how professional that was? She was ready for it. I like it. So guys, make sure you guys go check out the website. If you guys are interested in TRT, peptides, all that kind of stuff, or if you just have questions and want to reach out, make sure you go to the website.
If you're struggling with mental health or drugs and alcohol, you can also DM me, and I will do my best to point you in the right direction.
I love that. Yeah. So guys, everything that she just listed off right there will be linked in the description, so you guys can go straight to anything that you are interested in. Make sure you guys give a like, a subscribe, a follow on her social media, the YouTube page, all that kind of stuff. We're all about supporting here in Jacksonville, right? So make sure you do that. Also, while you guys are in the subscribing, liking, and commenting mode, make sure you guys check us out. It's going to be at Who Are You Pod from everything from Instagram, TikTok, Twitter, Facebook, all the normal spots, and YouTube. For the YouTube channel, it'll be Who Are You Podcast, and you guys will be able to find us on there. And then my final thing is, if you guys feel like you'd be a good fit for the show, you're an entrepreneur, business owner, artist, musician, really a mix of anything, you feel like you'd be a good fit, shoot me an email. It's going to be whoareyoupod@yahoo.com, and maybe we'll have you guys on a future episode. But as I say every week, y'all, thank y'all so much for your time today.
Thank you for inviting me.
And make sure you guys give us a follow. And like I said, we'll see you guys next week.
Bye. Thanks.